So they are traveling for ESWT, extracorporeal shockwave therapy. It is a non-invasive procedure used to remedy or resolve your heel pain. So instead of going to a doctor 15 times or 20 times in order to try everything that you possibly can, and you still have heel pain, there is a one-hit wonder out there called ESWT. There is no surgery downtime, no anesthesia involved where you have to go to sleep for the surgery.
Dr. Stashak, tell me about your background as a podiatrist.
I've been a podiatrist for 22 years in 4 different states, preferably trying to stay away from surgical procedures, looking for the newest, most modern, non-invasive surgical procedures in order to correct foot and ankle pain for anybody ranging from newborn to 104 years old is my oldest patient.
Wow. That's great. So what area primarily does your practice serve?
This is located in Lewis Center, Ohio, right on the outskirts of Columbus, Ohio, which is the middle portion of Ohio itself.
Okay, great. And do you work with patients outside of your area? Like, have you ever had anybody travel to come be treated by you?
So I see people from all over the United States and actually 4 different countries.
Wow. So is that for, I'm asking primarily, you have this thing called, it's like revolutionizing. It's called ESWT. Is that what they're traveling for? Can you tell me what that is? A little bit of information about it?
So they are traveling for ESWT, extracorporeal shockwave therapy. It is a non-invasive procedure used to remedy or resolve your heel pain. So instead of going to a doctor 15 times or 20 times in order to try everything that you possibly can, whether it be injections, padding, inserts, stretching exercises, physical therapy, ultrasound, EPAT, and you still have heel pain, there is a one-hit wonder out there called ESWT. The machine's been out there for a little over 20 years. Originally started about 40 years ago to break up kidney stones and gallstones. And then about 22 years ago, when I started practicing, is when they came out with the machine in order to break up calcifications in veins of tissue, such as plantar fasciitis, which is heel pain, Achilles tendonitis, tennis elbow. And it is done through electrical shocks that break up. It kind of cavitates the tissue to break up all the calcifications in the tissue, basically stripping all the rust off of that band of tissue and making it brand new again. And you're able to walk the same day, and you're back in your shoe the same day. So you're missing no work, you're missing minimal high impact activities. Because I tell everybody, take a few days off of high impact activities. Otherwise, there is no surgery downtime, no anesthesia involved where you have to go to sleep for the surgery. I do numb up the foot a little bit in order to do the procedure itself because they are what's called high intensity shock waves.
Are there any metrics of like what's the success rate on that?
So I have found that it's a 92% first time success rate. Let's say you've had this heel pain for years and you've tried everything. You would be considered a person with chronic plantar fasciitis. So the majority of the time, 92% of the time, if you do this procedure, you will walk out of that office having no discomfort, with minimal discomfort over the first week or so. And if a period of 4 months goes by and you are not at least 60% better, that is when I will repeat the procedure, which takes about a half an hour. And now it has a 98% success rate.
Wow. That's incredible.
It is. I mean, there's no need to have surgery and downtime and risk anesthesia and release your foot's shock absorber, which is going to cause more problems, because with the EPF that the majority of podiatrists are trained to do, as I was trained to do, I just don't believe in doing the procedure. You release that band of tissue, you're changing the structure and function of the muscles of the foot. Eventually that arch is going to begin to collapse. You're going to have a limb length discrepancy. Even though it's only a couple of millimeters, it still throws you off. So eventually over the months to years, you're going to have lower back pain, hip pain, knee pain, because you're not walking properly.
Wow. So if somebody, you said people can come out from the area you're in or out of the area to come see you for this particular procedure. Is that because are there a lot of podiatrists who offer this? Is it like?
There are not a lot of podiatrists that offer it. In fact, the area that I'm in, Columbus, Ohio, it's about a 250-mile radius of where no one offers ESWT. They may say they offer high-intensity shockwave therapy, but what they're actually doing is doing what's called EPAT. And it's an electrical pulse activation therapy. So if your podiatrist says, hey, listen, you're going to need 1 or 2 of these treatments a week for 5 to 10 weeks, that is not high intensity shock wave. That is low intensity shock wave that they are portraying as high intensity shock wave therapy. Because if you do your research on the net, you're like, oh yeah, I want this high intensity. But then they tell you, oh yeah, it's $150 a pop, and you're going to need 2 a week for 5 to 10 weeks. That is a high form of physical therapy. High intensity shockwave therapy, ESWT, also known as orthotripsy, is a one-hit wonder.
Wow. So if somebody is considering this, or they want this therapy, what should they do? How would they get in contact with you?
So it's actually not a therapy. It is a treatment. There's a difference between therapy takes multiple visits, and it could never help. This is a treatment, a non-surgical treatment for the resolution of heel pain. And I recommend that everybody go to my website, midohiofootlandankle.com, in order to read everything that you can. I have comparisons between EPFs, the endoscopic plantar fasciotomy, which 92% of podiatrists offer around the United States. And that's what they'll tell you. If you failed all the conservative therapy, the only surgery I can recommend is doing the EPF, the endoscopic plantar fasciotomy. That's one where you're down 6 to 8 weeks. You're weakening the structure of the foot. And even though they sell it as though, oh, it's not going to cause that, it will, because one thing that they'll tell you afterwards is, hey, listen, you're going to be dependent on a hard, rigid insert for your shoe from now on in order to help support that arch. Why? Because they know that if you are not wearing that, your arch will begin to collapse. So make sure that if you get up at 3 o'clock in the morning to go pee, you put your shoes on with that orthotic inside of it, because over time of you getting up out of bed walking without some type of an insert to support that arch, your arch will begin to collapse. With the ESWT, no supports needed. I do recommend what's called accommodative inserts. You can find them on Amazon for about $35. They're nice and soft inserts afterwards in order to help cushion the foot just a little bit. But in all honesty, I put my people right back inside of their shoes and they go right back to work.
Wow. That is incredible. Okay. So with that, go to your website, call your office, schedule a time. You guys will do you just do appointments? You do consultations?
We will do telemedicine. If they live a far way away, I always recommend that they call in, and we can always do something over the internet and that way they get all their answers or all their questions answered before they travel. Because again, I'll see people from 3-4 states away because they've done their research and they see that, okay, I can either go to New York to have this done, or I can go to Ohio to have this done, or I can go to Missouri to have this done. And those are about the only 3 that I know around my vicinity.
Gotcha. All right. Well, thank you, Dr. Stashek, for that information. And I recommend anybody who's looking for the ESWT to contact Mid-Ohio Foot and Ankle Specialist, and Dr. Stashek will take care of you.
Yes, I will. Thank you very much.
Thanks so much.